I stayed 1 month believing that I had a stroke.
The commonest condition that gets misdiagnosed in patients who have multiple sclerosis actually is stroke. Like if you get weak on the right side of the body, that can present as a cerebral stroke.
And after that, I went to the BDF when I got diagnosed over there with Dr. Mohammed Fella with multiple sclerosis. So we can count it as it was from 2009, but I didn't know about it till mid of, like, after 2 months of the first years.
A new experience. I felt I'm not the same as every day. I discovered I cannot feel my fingers. I cannot remember many things. And after a while, I discovered that I have MS. The last stage of the symptoms was I was paralyzed, half the body, the right side. It was the worst period in my life. It was very hard.
I didn't have, like, I don't know the word, but I couldn't do anything. I was disabled in some way. This last year I had the second attack. I had optic neuritis. I didn't see with my left eye, and I was diagnosed last year when I was 14.
All the multiple sclerosis patients, they go with an MRI for the spine and for the spinal cord and brain. So that would confirm the diagnosis, and that's what happened with me.
The main test that we do for multiple sclerosis, because there are multiple lesions in the central nervous system, including the brain and the spine, is to do the best available MRI scan of the appropriate area. So if there is an involvement of the brain, then we do MRI of the brain. If there is an involvement of the spine, then we do MRI of the cervical spine. In addition, we have to do a special test, and that is to take out the fluid from the back, and that fluid is called as cerebrospinal fluid. And that fluid has to go in for examinations to understand why this particular patient is getting the symptoms related to the multiple sclerosis disease process itself.
MRI, I was not sure if I can do it or no. I was scared, but after a while I insist on it. My case was very difficult, and I did it, thanks God, and we discovered that it is MS. I don't know what is MS, but it's only a name for me, but at least I know what's going on.
2010, I had an MRI, but it wasn't clear that I have multiple sclerosis. Last year when I did the MRI, it seemed that I have multiple sclerosis, so MRI.
Actually, there was no reaction because I didn't know what the sickness was. But the doctor gave me like a piece of paper, and he told me, if you love to read, go and explore and see what the sickness is. Plus, he said, you have the first stage, so when you're going to go with that, read about relapse remitting, and that's the first stage of multiple sclerosis.
Multiple sclerosis, by definition, are problems related to the brain and the nerves which come and go. Come and go in the sense that there is a particular paralysis which can come suddenly, but as time goes by, that particular deficit or paralysis becomes better day by day with medicines or by nature. And the patient actually becomes normal and carries on their normal activities and even forgets about the fact that he or she had some problem maybe years back. And then this problem comes back again, and it's very unpredictable on which day, at what time it will come. So that is the meaning of relapsing and remitting. Relapsing means that the paralysis comes and gets relapsed again. And remitting is the reverse process of getting better on its own or with medications.
So didn't scare me.
I was prepared myself to do many things, and suddenly I have to stop and think about it again and again.
As soon as they get this news that they are part of the multiple sclerosis disease process, they actually become very, very anxious. Some of them start crying right at the beginning. that they are suffering from an incurable disease, and many of them get depressed over a period of time, and matters are made worse by relatives who have half knowledge and do not understand the basic process of the disease process. Now, that it is an incurable disease is in a way not true, because more and more medications and newer medications related to the research process of the disease process have come out, and people have become better. And there are many patients over a period of 8 to 10 years, they're leading normal life. Females get pregnant, they have children, and they are absolutely normal in all respects. And the other side of the spectrum is also true, that there are patients who land up in the wheelchairs and they are incapacitated, and they are they have to be supported by the family, and they feel that there is going to be a burden on the families. So both aspects of this disease process is true, but I think with more and more research, more and more people are getting better over the years than what we used to see and do about 10-15 years back.
And someone told me that I have multiple sclerosis. If I don't do that, I'll get that, or that's what happened. I was shocked and scared.
I was half paralyzed the first time, and it didn't come back again until I got optic neuritis the second time.
It means that the optic nerve gets degenerated, and because optic nerve is related to seeing things, the person is not able to see things suddenly, and he sees darkness in front of the eyes, and sometimes he may see double vision.
I started to see a little bit of blurry vision, and till I lost vision in the left eye, started to be pitch black. So that was the second time I got an attack.
40% of the patients, they experience usually symptoms in the eye for the first time. So in that strict sense, about more than 1/3 of the patients will definitely have some symptom related to diminishing in the vision, or drop in the vision, or fog in front of the eyes, or blackness in front of the eyes, and they'll not be able to see with either one eye or sometimes even both the eyes. This is the most common symptom. The next common symptom is related to the urinary bladder. That means suddenly a person will not be able to void the urine, and he will not be able to urinate properly. This is also a very common symptom for multiple sclerosis. Third common symptom is sudden paralysis of either one side of the body, or sometimes even both the legs, or sometimes both the hands, depending upon where the multiple sclerosis problem occurs in the nervous system.
First of all, I felt numbness, weakness, and then
memory loss now has been established as affecting the patients of multiple sclerosis even before the whole process of multiple sclerosis has started. These are recent studies which tell us that memory loss is now becoming a very, very important part of the disease process, and at a later stage it is very, very evident and very prominent, and patients do realize that their memory is also failing, apart from the fact that they are having multiple episodes of the disease process itself.
And finally, after a few days, I was paralyzed. It was the very worst one for me. I didn't expect that it will happen quickly as this.
The first few episodes of the disease are very, very sudden and very severe. So suddenly, one fine day, a person is normal and gets up normal, and another maybe 1 hour or so, he gets totally paralyzed. And that's a very, very traumatic process. It looks and behaves like a paralytic stroke, and it is also misdiagnosed as a paralytic stroke by many of the doctors who are not aware of the disease process as neurologists are. So in that way, it is very, very disabling. It becomes very traumatic, and it becomes more traumatic because since the disease process is more found in young population to get paralyzed is very, very traumatic to the family. Patient who has a chronic disease process, whether it is multiple sclerosis or even diabetes, they do get depressed in the long term from the fact that the disease process is going to last with them forever or for a long period of time. And depression is part and parcel of multiple sclerosis, just like memory loss or memory impairment is now a part and parcel of the multiple sclerosis.
So actually there are two types of medications that you get to avoid the attacks. You start using vitamins that I've been using, like B1, B12, B6, omega-3, D3.
Vitamin D in particular has been known to help the disease process, and many of the doctors add vitamin D supplement to the whole treatment.
Plus, during the attack, you start to use the cortisone, as everyone knows. It's being called solomidrol. Use that like 3 times when you have the attack, like three consecutive days. And then we start to get the nerve back again, to start living our normal life.
Cortisone does help in the severity of the disease process in the initial 3 to 5 days, and that is very important because cortisone has to be used in most of the patients. This reverses the activity of the multiple sclerosis process, and the patient does become better faster. Now, regarding the side effects of the cortisone, since we are going to use it for a very short period of time, maybe 3 days or 5 days maximum, I don't think that is related to much side effects. In the long run, it may have some side effects if we keep on using it again and again.
My doctor was very careful with me. He started to give me vitamins, multivitamins, and plus my vitamin B, cod oil, and he started to solve the problem with the paralyzation by giving me steroids injections.
Steroid injections are always used in patients who have multiple sclerosis in the sudden acute condition, and it is used for a period of 3 or 5 days, and it is known as pulse therapy of multiple sclerosis treatment.
I was recovered very well. It was fine for me. And after a while, I discovered that because of my lifestyle, it helped me a lot. I was, long time ago, very careful with my diet, with my weight, with my health. No canned food, no fast food, no tea or coffee. No smoking, of course. Plus, I was enjoying my life in a good way, separating my personal life, and there is a barrier between personal life or practical life and family life. So this has helped me a lot. I think this is like a result for cumulative steps I did long time ago.
I work out because if I work out, I'll let the pain go away by letting sweat just unleash anything. If I have energy, I just unleash it so I won't feel like I'm dying or anything.
Working out and remaining active and being positive and having an optimistic view to the whole process is a nice way to combat the disease, especially since the disease has its own relapsing and remitting attitude.
Actually, I have my own personal way of dealing with the disease itself. It's like I've been told by the members of the society, the doctors themselves, other patients outside environment of work or the society to start taking the medications that are being called beta interferon. But I have my own philosophy against that. I'm against using these drugs and going with the normal treatment, stress-free, organic food, anything else that will make me avoid the chemicals that they're being using. As I've seen that few of these medications made our friends suffer more than gain more health.
Most of the medicines which are used in multiple sclerosis are related to modulating the immune system of the patient. And we do know that when we try to do the same, sometimes things can go wrong. So some patients do develop severe side effects from the medications, and these side effects are so severe that you actually have to withdraw the medication. In a way, those patients are going to be harmed more by the medications than the good that the medications are going to provide.
So that's my own philosophy. I'm being backed up with my doctor. So he's following up my condition regarding my own philosophy. So far, I'm doing so good.
Actually, I never lose in my life. I was sure that happiness is there, but we have to search for it, or we have to turn right and left to find it. That's all. So this helped me a lot. I have to be very optimistic, and everything will finish quickly.
My personal philosophy as a doctor is that every disease which is chronic is getting researched at very high levels at various institutions, and finally man is going to be able to conquer most of the disease processes, including cancer. There is a cure for everything. It's a matter of time, and it's a matter of will of the patient and the optimism that the patient has. So we don't know that even if you have cancer, you still live a good normal life, and this is particularly true in many of the cancers that we know. So relatively, we know that multiple sclerosis is not a cancer, and in a way you can lead a normal life, even 10 to 12 to 15 years, and absolutely be normal in all respects.
It actually affects the daily activity once you have, like, when you're being stressed. It's like you start feeling the pain in your legs and your arms, you start feeling the fatigue. You can't cope with your co-workers, with the family members. The worst thing about the MS that it doesn't show, so people can't see it. You're the only one who can feel it. So when you're going to walk with a stick or come with a wheelchair, or even say that you're in pain, no one can see the pain except you. So that's the worst part, for people to believe they actually have the pain.